Hey guys, Dr. Joel here at Fabrizio's. We're here with Kelsey. She's a student intern of ours from Heidelberg, and it's final season. A lot of studying, a lot of hours studying. We've talked to her. She's been experiencing some pretty significant low back pain, and a lot of it stems from those long hours of studying, maybe not in the best postures. Some of you can probably relate to that. I know I can remember some of those times. So we're going to do a little treatment on her today to show you guys what we can do for things like this. So we're going to do some dry needling right into the muscles of the lower back here. That's what we're going to start with. And I'll explain that as we go here. So we're using 3-inch needles here. And we're going to go right into the lower back muscles. You'll see the muscles twitch like that. That's a normal response to the dry needle. When you hit some of those trigger points in the muscles, you're going to get an instant contraction of the muscle like that. So that was good. Did that hurt, Kelsey?
No.
Good. Yeah, it's not too painful. Every once in a while we'll hit some nerves that can cause a little bit of pain, but for the most part, just some pressure in the area where the needle is, and it usually relaxes really nicely for us, so that is good. So we'll do a few areas here. And as you can see, I'm putting these needles in pretty far. That's right down to the bone on that one. And we'll usually do 4, 6, maybe 8 or more needles at each treatment session. Just depends on which body area we're focusing on. So these are one-time use sterilized needles. How we doing, Kelsey?
Pretty good.
Good. Okay. Good. And so one thing we know, guys, is that we really don't have to leave dry needles in very long. A lot of people ask that question. And so usually I'll get as many needles as I'm going to put in to the area. I'll do a little bit of manipulating on the needles. Just going to increase the effect a little bit. And then we'll simply take them out just like that. So this is the most effective treatment that we can do for those muscular trigger points, those knots, those tight spots that you can feel inside muscles. So you could massage them, you could use electrical stimulation, but nothing works quite as well as putting a needle directly into that area. So that was good. Okay, now we're going to do a little bit of a spinal adjustment here on the pelvis. She's got a little bit of rotation here through the lower back. So a little joint restriction too, the just not moving as well as it could be. So we're going to adjust that. So go on your right side here, Kelsey. Okay, excellent. I'm going to have you bend this leg up just a little bit. Good. Good. Okay, flip over this other way. So pretty quick, guys, very efficient, not painful. Usually actually feels pretty good. You'll hear that clicking and popping. That's a normal joint sound. When you stretch the joint capsule a little bit, there's fluid inside the joint that releases pressure, and that's the popping sound that you hear when the joint moves. Good. On your back now. She was a little more tight on the right side. Now we're just going to get that transition segment from the middle back to the lower back. Good, and one more, just have you sit up a little bit. Good. There we go, good. Okay guys, good. So that's how we treat lower back pain a lot of times in our clinic, especially that kind of chronic back pain from postural strains, things like that. So if you know anybody that's got a problem like this, check us out. How'd it feel, Kelsey?
Feels great.